is Janice Lopez from the International Organization for Migration, and welcome to the Migration Health Research Podcast. In this issue of the Migration Health Research Bulletin number 27, we feature publications on migration, zoonosis, infectious diseases, non-communicable diseases, mental health, among others. We feature two interviews on this audio podcast episode, an interview with Dorien Braam and Katy Barwise. Dorien Braam is an assistant professor of social science in One Health at the London School of Hygiene and Tropical Medicine and the Director of Praxis Labs Research and Consulting. She speaks about the importance of the inclusion of migrants into policies and actions towards zoonotic disease prevention and control. Let's listen to Dorien Braam.
With these briefs, we aim to put animals more central to the discussion around migration. For instance, in the Eastern Horn of Africa context, animals are key to people's livelihoods and lives, and they need to be better facilitated in migration and refugee responses. And at the same time, in Thailand and elsewhere, we see that exploitation of labor migrants and animals often goes hand in hand. And while there's increased understanding and acknowledgement of the interconnectedness and dependency of animals and humans, including in terms of health, animals need to be better included in policymaking and response. So both briefs developed based on research that I conducted on zoonotic disease dynamics in displaced populations. We know now that up to 75% of emerging human infectious diseases originate in animals, which shows the biological kinship between animals and humans. We call these diseases zoonoses, and this most likely includes, for instance, COVID-19, which we expect to have originated in an animal species. And as a result of climate change and changing movement patterns of animals and humans, we also see more frequent outbreaks of other zoonoses, such as Ebola and avian influenza, and the latter sporadically jumping to humans, which is of great and increasing concern. However, there is a risk involved in considering animals as a source of disease, as we also depend on them for our lives in terms of food, nutrition and biodiversity, as well as livelihoods. Instead, research increasingly highlights how zoonotic disease risk and vulnerabilities are primarily linked to human actions rather than the mere presence of animals. In 2019 and 2020, I conducted fieldwork in Pakistan and Jordan to study the role of animals in displacement and zoonosis, particularly in internally displaced and refugee populations. And I designed this study based on my previous experiences working in international organizations and governments, whereby animals were excluded in humanitarian policy and responses out of a public health concern. However, as mentioned before, rather than an outcome of displacement and the presence of animals, I found that zoonotic disease risk was primarily a result of health inequalities faced by migrants and refugees.
Who do you think would most benefit from these thematic briefs, from reading this? Who are the primary audience of these briefs?
So with the development of these policy and technical briefs, I hope to reach a broader audience than what is possible with, for instance, academic papers. Those are often only read by a select group of experts, and these briefs are more widely circulated among policymakers and practitioners, including implementation agencies at field level. So besides raising people's awareness of the plight of animals in disaster and displacement and the important role they play in the lives and existence of migrants and refugees, we also hope that through these briefs action will be undertaken by those in charge of designing and implementing humanitarian and development policies and responses to better facilitate animals in displacement contexts.
What were the key findings from these briefs that you would want to pinpoint in this interview?
So with these briefs, we try to highlight that zoonotic disease does not necessarily increase during displacement. Currently, population movement is associated with increased mixing of displaced, mobile and host human and animal populations, including through increased contact between domestic animals, wildlife as well as humans, and their interaction with new disease pathogens and vectors. However, of similar importance are the crowded and unsanitary living conditions in relief and refugee camps, which increase vulnerability to infectious disease, further linked to malnutrition and long-term stress as a result of movement. Health services staff may also be affected during disaster and displacement, which hampers an organized health response, as well as the availability of quarantine and vaccinations, for instance, in turn exacerbating the risk of zoonotic disease outbreaks. Meanwhile, animals are also essential for people's health and nutrition, as well as biodiversity and ecological balance, so their presence might actually also be beneficial for people's health. And more specifically related to labor migration, the COVID-19 pandemic highlighted how labor migrants, through their substandard working and living conditions, are at a much higher risk of zoonotic disease. Around the world, they were among the population group who were unable to work from home or shelter in place. Instead, they often had to provide for remittances and lack access to social services and support systems, which makes them particularly vulnerable to infectious disease. Meat production plants, meanwhile, where labor migrants work in challenging conditions, became hotbeds for COVID-19 outbreaks across the world, highlighting the link between human and animal exploitation, which calls for a multi-level reform of the system.
What are the implications of these findings for a policy or program?
These briefs imply that the complexities of the climate change, migration, and zoonosis nexus are still not well understood, and this is partially the result of a lack of intersectoral and multidisciplinary collaboration. Similarly, animal exploitation and welfare is rarely connected to migration and health. So the issues highlighted in the briefs require interdisciplinary systems thinking to understand the connections between migration, labor conditions, socioeconomic developments, and health better. And importantly, migrants need to be involved in agenda setting, and the private sector has an important role to play as well. Climate change and conflict will exacerbate environmental challenges, causing further internal displacement and migration, while affecting the environmental risk factors related to infectious disease spread. Movement of humans and animals does not necessarily cause disease, however, but it changes zoonotic disease dynamics, which need to be better understood. So there's a need for more inclusive policies, both including migrants as well as animals, for more sustainable approaches to migration and refugee contexts. The briefs are very much an example of the systems thinking that's needed through a One Health lens. So the One Health approach was developed to enhance collaboration between human, animal, and environmental health actors, and is increasingly adopted since the COVID-19 pandemic. At the same time, however, institutions and organizations remain siloed in their thinking and address migration and animal health as separate fields of interest and knowledge. These briefs show, however, that animals need to become more integrated in migration policy and responses in general, but also more specifically looking at migrant health. Animals do not only provide food and nutrition, but are key for people's livelihoods during resettlement or return, and contribute to asset building, social standing, and mental health. We therefore highlight with these briefs that One Health in migration involves promoting and ensuring human, animal, and environmental health throughout migration, which will contribute towards food security, assets, employment opportunities, and also gender equality and facilitating migration in the context of climate change adaptation, while enhancing the resilience of affected communities. So the briefs show that while states and regions have variable progress, there remain important gaps in responses to migration in the context of climate and environmental challenges, while national regulatory frameworks are often not yet sufficiently financed and implemented. We argue for more participatory and flexible approaches for short and long-term solutions to align with the global trend towards localization and resilience building, which will bridge the gaps between humanitarian and development assistance as well. And importantly, of course, migrants and host populations need to be included in the development of these policies and programs, and their agency further supported through enabling inclusive legal frameworks and sufficient direct funding.
We also discussed the publication centered on guiding the integration of migration into health interventions with Katy Barwise, IOM Senior Program Manager for the UN Network on Migration Secretariat. Let's listen to Katy Barwise.
The aim of this toolkit is really to support much stronger reflection of migration and displacement in health interventions globally. As we know, migration is a social determinant of health, so your migration or displacement status will have an impact on your health, and that includes communities that are affected by migration. Migration, of course, also impacts health systems. Health worker migration has an enormous impact on the health system of countries of origin and of destination. And then beyond the workforce, migration and displacement impacts the whole of the health system, so essential medicines, financing, health information systems, etc., etc. And so overall, the aim is to say, right, migration and displacement are so profoundly linked to health and vice versa, and that needs to be reflected in the interventions that we're undertaking as development practitioners. And I would say, that also goes beyond just the development sphere and, of course, into the emergencies and humanitarian sphere as well. This toolkit came about to respond to that need. It's a very practical toolkit. It's for people who don't have much time. They need some support in saying, I'm not a migration expert. What do I need to do to make sure that all these issues that are so cross-cutting to the work are reflected in what I'm doing at country level?
Who are the intended users of the toolkit? Is it primarily at the country level, or can this also be used at the local government units, for example? Can you expand on that a bit, Katy?
So the initial aim of the toolkit was, we were initially approached by then DG DevCo, now DG INSPO, which is the EU development branch, and requested to put something together through which they could support migration to be better reflected in their development programming, their development cooperation globally, in particular at country level. So they have health experts sitting in many countries and regions. The tool would be there to support those health experts to reflect migration and displacement in the health programming that they're doing. Having said that, as we began to develop this, it sort of took on a new life of its own. We started working also with some of our UN agency partners. So WHO is a partner, for example, ILO is a partner to reflect the health worker migration aspect. And as we did so, this became bigger than the original scope. So yes, it is primarily for development cooperation actors sitting at country level. But from my perspective, and I think from the perspective of all the partners and from the EU, it's very much applicable beyond that. So yes, if you're sitting in local government as a health specialist, developing your health plan, for example, there's checklists in there, there's information in there that can help you put your plan together. So it really goes beyond that initial scope.
Would you like to share with us in a little bit more detail on how the toolkit will aid in the integration of migration into health interventions at the country level?
The toolkit itself, the way it's structured is to basically say, we're going to give you, okay, you are not a migration expert and you're probably not that familiar with, migration language even, or the global frameworks through which migration is governed. You can pick this up and you can get all the information that you need in terms of this background information. At the same time, there's a series of tools that can help you depending on which stage you're at, your planning cycle or your programming cycle. So it starts off with this narrative section to explain what are the links between migration, displacement and the health sector. And that's really structured around the 6 building blocks, a little bit adapted of the health system. So we have a section on service delivery. Why is it important to think about migration affected communities, for example, when you're planning for your service delivery? We have a section on the health workforce. How is health worker migration managed? What are the options in terms of, for instance, WHO guidelines on this? There's a section on health information systems, access to essential medicines, financing, leadership and governance. And really this is to explain what are these links, what's the analytical and evidence-based linkages between migration, displacement and these subsectors. So that's the first part. If you're coming in this and you really don't know where to start, that's the place to go to. The second part, and this is sort of what makes up most of the toolkit, is this series of tools that are really there to support you to ask the right questions and to give you the right answers as much as possible as you're going about your programming, implementation, monitoring, and evaluation in a health intervention. So there you have tools, for example, to help you undertake a situational analysis or to review a policy to check how sensitive it is to the migration and displacement needs. So, for example, if you're conducting a situational analysis of, country X health sector, health needs, what sorts of things can you be looking at to get the adequate picture in terms of migration and displacement vis-a-vis health? Are there particular regions within that country that you need to be integrating migration into service delivery in those regions or communities in particular? Who are the people you need to talk to? There's a stakeholder analysis tool to get that information. How can you make sure that you're getting the community voices and, affected populations voices into that situational analysis? So you're really getting the big picture, because very often with migration, it hasn't been considered from at the top level. So you really need to go to local communities to get the information that is needed. So there's all sorts of tools for getting the needs and making sure that as you're doing your health needs assessments, this aspect of migration can be considered. Secondly, then, when you go on to design your interventions, there's a series of tools to support you to do that. So again, the stakeholder analysis comes into play there, because in order to get a good project, program or intervention design, you need to be talking to the right stakeholders and talking to the right people. there's a risk analysis tool, and then very importantly, and perhaps the most innovative part, is that there is sort of generic theory of change to demonstrate what the results will be, how the results chain through integrating migration less. If you make this intervention at this level, then what will be the results at the highest level? So, for example, without targeting displaced persons in a particular health intervention, then you won't have the right health results or health impact at the overall level. There's a lot more detail in that. So it goes through activities, outputs, outcomes, and then impact level results, which of course are connected up to the SDGs and the global frameworks. So that theory of change tool, I think, is very important to demonstrate why through a small targeted intervention, let's say sexual and reproductive health services for a migrant community, will of course have such a greater impact on the wider picture in terms of health. So these tools are there to really support people who are maybe less familiar with all of these issues, to really bring in the critical aspects of migration programming into the health work that they're doing.
This is such a significant work that IOM and your team has done. If you'll allow me, I'll just add one more question as my last question, Katy. Has there been any dissemination activities or campaigns, advocacy that has been conducted in line with this project that has been already done or you are currently involved in?
These toolkits were developed a couple of years ago, and since then there has been some work to disseminate, particularly through the EU channels. So when I was working on this, we were working with EU delegations to reflect this work into their multi-annual planning that they're doing at the country level. So there was a lot of dissemination then, and I know that's also continued in the last couple of years, a lot of outreach, a lot of trainings with EU delegations. I think that there's a lot more that needs to be done. This is a tool that could help pretty much anyone. And I think in IOM and the UN, that's also going to be an opportunity, I think. So, for example, I would suggest that this could be used when we're doing project development in IOM or when we're developing cooperation frameworks of the UN and UN country teams. So I think the next step is to make sure that that dissemination is going beyond the initial EU partners and that this can reach a broader community, because a lot of the work has been done in this toolkit. You know, a lot of coordination has been done, like I said, with partner agencies. It's not an IOM product, it's a joint product. And this can really save a lot of time at country level in, you know, starting from scratch. So I think the next step, really, the focus is to get this out there and make sure that people know it's there and can help them. When I was based in countries working on health programming, then this would have been a very, very useful tool to help to support convening different agencies to say, look, this work's been done already. Let's use this as a basis for some joint programming. I think that's where we should be moving next.
Thank you very much, Dorien and Katy, and thank you all for listening. Please feel free to share feedback with us. See you on the next podcast.